As research advances, more women are choosing to freeze their eggs, and to cater to those needs and the huge number of women in that group, egg freezing boutiques are becoming very trendy. So you might be thinking, what is that? Those boutiques market all types of fertility services in a spa-like atmosphere for packaged pricing. But not all fertility doctors believe it is the best or safest way to go. Fertility specialist Dr. Thomas Kim is here to talk a little bit about that and give us an education. Doctor, thank you for coming.
Oh, you're welcome. Nice
okay, so let's talk about egg freezing in general, because I think there's a large, the millennial generation and kind of Gen X generation, we're all kind of in this group where we're wondering, when do I have to do it? Right. Is there a time that I should do it? Is there a time where I should not do it? So tell us a little bit about the age ranges for optimal egg freezing and whether or not we should even be considering it.
Women are born with a certain number of eggs, and there is no such thing as regeneration of the egg cells, unlike sperm cells, right? So we know at certain age, egg quality starts declining.
And what age is that?
Exactly. Most people don't realize it is a lot earlier than they realize. It is about 27, 28, late 20s.
I thought it was in the 30s.
35 is the most common answer we get, but it's about late 20s.
So egg viability, egg
quality.
Egg quality starts to diminish by age 28.
Yeah, late 20s.
But that doesn't necessarily mean that you need, if you're 28 years old, you need to run out today and get your eggs frozen.
Exactly. So, but you may need a little more eggs to choose from, because just to give you some, in number sense, some perspective, in IVF clinic with the lab scientists, we talk about egg to baby ratio. How many eggs does it take to make a human baby in the laboratory? It all depends on the egg quality. If the egg source is from somebody in their mid-20s, maybe about 5 or 6 eggs, that'll translate into one viable birth. Mid-30s, maybe about 10 eggs. At age 40, it takes at least 15 eggs to find that golden eggs that translate into a live birth.
My goodness. Okay, so what I want people to understand as well is it's not just the amount of viable eggs that you have to deal with and your age that you kind of have to start thinking about, but also once you have chosen to freeze your eggs, there's also fees on top of that, right? There's storage fees and there's all these other things that you need to kind of think about.
Exactly. Yeah, fees are, it's not
cheap.
It's not cheap. On the average, it runs somewhere between $6,000 to $10,000, depending on the region.
For how long?
No, that's just for the procedure itself. Right?
Okay.
Because to get the eggs out, it's not like a human eggs waiting to be collected. We have to stimulate with the fertility medication for a certain amount of time. Then at least probably about 10 days later, we'll collect those eggs under anesthesia. Then we have to process this in the laboratory. So it's not cheap to do that.
It's not cheap, it's not easy, it's not quick.
So that cost is probably about $6,000 to $10,000 depending on the region in the country. But I think you're talking about how long you can keep it. You have to pay for the storage fee.
That's what I'm saying.
Yeah, on the average, maybe about $1,000 a year.
Oh my goodness. I had no idea it was that much. And how long can an egg stay frozen?
Theoretically, there is really no limitation. We know that the metabolic process stops at the point of freezing. So whether it is day old or 20 years old, they should work the same way.
Technically.
Well, I mean, we have a clinical case that, in this case, is embryo case. Embryo and eggs are a little different, right? Egg is just a half human, directly from woman. Embryo is a mixture of sperm and egg. So with the IVF technology, we've been freezing embryos a lot longer. So longest embryos that have been cryopreserved, thawed, and came to life, 21 years.
My goodness.
So it is at least good for that duration, but who knows, probably even longer.
It's a really good option. Now it's important for women, especially in their late 20s, if they're not ready to have children yet, they're focusing on their career, they should probably at least talk to their doctor,
Exactly, yeah. The pitfall of this egg freezing, though, I mean, I think this boutique clinic is a good thing that it brings the awareness of the people. Yeah, that's an option. However, it's not for everyone. It all depends on the quality of the eggs and how many eggs they can produce. And also, the clinic, too. Not all clinics have the expertise or experiences about freezing is okay, but freezing is just a small portion of the whole scenario, right?
So you really have to be careful with who you're going to, is what you're saying.
It has to be the experienced IVF laboratory that had experience with the freezing and thawing the human tissue, and have a proven track record of giving birth.
Okay, that is all important information. Thank you so much for your time today.
Oh, you're welcome.